Does occult blood always mean rectal bleeding? Imagine checking your stool and finding tiny traces of blood that you can't see with your eyes. That's what we call occult blood. But does this always mean you're bleeding from your rectum? Not necessarily. Let's explore what occult blood really indicates and what it doesn't. Occult blood is blood that's hidden in your stool. It's not visible to the naked eye, but laboratory tests can detect it. These tests are often used in screening for colon health issues, especially colorectal cancer. When a test comes back positive, it means there's some bleeding somewhere in your digestive system, but it doesn't tell us exactly where or why. Now, bleeding that comes from the rectum or anus is called rectal bleeding. Usually it's visible, like bright red blood on toilet paper or in the toilet bowl. But sometimes, small amounts of rectal bleeding can also be hidden in the stool, making it occult. However, occult blood can also come from higher up in the digestive tract, such as the stomach or small intestine. For example, ulcers or gastritis can cause bleeding that results in occult blood in your stool, even if you don't see any blood. So, to answer the question directly, occult blood does not always mean rectal bleeding. It simply indicates that there is blood in the stool that isn't visible. The source could be anywhere along the digestive tract. While rectal bleeding can sometimes be hidden and detected as occult blood, most cases of occult blood originate from higher up in the system. This distinction is important because it guides medical evaluation. If you have a positive occult blood test, your healthcare provider will likely recommend further tests, such as a colonoscopy, to find the exact cause. It could be from benign conditions like hemorrhoids or polyps, or more serious issues like cancer. But it's crucial not to jump to conclusions based solely on the test result. Remember, having occult blood doesn't mean you have cancer or a serious problem. It simply signals that further investigation is needed. Everyone's situation is different, and only a healthcare professional can interpret your test results in the context of your overall health and symptoms. In summary, occult blood is a sign of hidden bleeding in your digestive system, but it does not always mean rectal bleeding. It can come from various sources, and further testing is essential to determine the cause. If you ever get a positive test, consult your healthcare provider promptly. Early detection and proper diagnosis are key to maintaining good colon health and catching any issues early.